your girl Miss Trace at Gym, and you are watching Gym Spot TV. I am here with my girl K.
Go. Period.
Today we're gonna be doing a mukbang. Well, you can't see our food. I guess we can lift up something. We're gonna be doing tacos, guys. Tacos. Guess for the screenshot. So we're gonna be doing tacos because we kind of wanted to lighten the mood a little bit, because we're gonna be talking about a pretty tough topic, which is, of course, if you're not aware, this is mental health awareness month, and this is lupus awareness month. So if you are affected by any one of these, you're gonna drop us a green heart for mental health awareness. You're gonna drop us a purple heart for lupus awareness. Okay, so first I'm gonna talk about lupus awareness really quick, how it kind of affected me, being a supporter of those who have lupus. My cousin on my mom's side, she was like my second cousin. She passed from lupus when I was young. You know what I mean? It was before, you know, you guys they were making so many good strides that they're making now. And, you know, if you guys don't know, my hubby has lupus. Well, it's in remission now, but he still has the effects of it. And I don't know if you ever live with somebody who's on prednisone, want to strangle them, you know what I'm saying? But those are that's one of the things. What about you? Anyone you know with lupus?
No, I don't know anyone personally.
Yeah. So it's like normally it's like Nick Cannon has it, Tony Braxton's, Sheena Arnold. You know, those are some of the famous people with lupus. And really, you know, when you hear of a man having it, it's kind of rare, because they were calling it like a woman's disease for a while. So it was like really rare to hear when men have it, and a lot of men were scared to really probably even talk about it, I guess, because when a woman disease, that's like having breast cancer as a man, you know what I'm saying? So yeah, so that's kind of like, you know, big ups to those who are supporters of those with lupus, and those who have to live with those with lupus, and big ups to those who live with lupus. You know, how you know, basically it's like your immune system attacking itself, you know what I'm saying? And that's a lot to have to go through. So it affects them mentally, a lot of them. My husband went through depression at one time and everything, and it kind of affects you, especially if you have issues with depression yourself. It kind of affects you in a hard way, and people don't really understand that. But, you know, we get through, we push through. We're some strong people, you know what I'm saying? But yeah, so mental health, you want to talk a little bit about that?
Yeah, pass the meat. Mental health, man, there's so much to say about it. Like, there are so many illnesses that people struggle with, and I think that when we talk about mental health issues, sometimes we use the terms too loosely, and that causes us in general to dismiss or to underestimate just how difficult it can be for someone to be living with a mental illness, and how difficult it can be for their loved ones trying to help them through that. And some mental illnesses would be like depression, major depressive disorder, bipolar disorder, schizophrenia, even anxiety disorders, things like that. And so when you're living with a mental illness, it can be very difficult. I can speak for myself. I suffer from mental illness, especially depression, and I've been struggling with it probably since I was like 14 years old. So it's a long time coming. And when you struggle with a disease like this, it's difficult, because even though you do have an illness, and in some cases a disability, it's not something that people can see. It doesn't necessarily have physical manifestations that people see and think oh, they're just having a bad day, or oh, they just must be tired, or you know, for us, even though we might feel, and depression actually can manifest itself physically. I've had like my whole body in pain, or backaches, or just headaches, and you know, things like that. It can manifest itself in those ways. But once again, this is not something people see and automatically think or associate with having an illness or disease or disability.
I just want to say, y'all ain't endorsing me enough. That's some good sauce right there.
And so, I think it's important to note that we should be careful about the way that we, you know, talk about things like that. Like, don't just be so quick to call somebody a name. Because for some people, that's a slur, saying somebody is bipolar. When really what you mean is they're being indecisive, or they're being XYZ. Like, put a name to it. Don't be so quick to throw a blanket term that is really a disability over something, or, you know, over just somebody not acting the way that you want them to. You know what I'm saying? But, you know, what else? I think for loved ones dealing with people with a mental illness, you know, wait, take that first bite. I'm not moving quick enough. Hold on.
I don't want to. Take the time to say these are some fire.
But for the loved ones that are supportive of people who are dealing with mental health issues, mental illnesses, mental disabilities, we really appreciate you. Like, we need those people in our corner who are able to just sit with us through those moments and who know exactly what to do or say to bring us out of those moments, or even those people who don't know what to do or say but just want to be there with you just to show their support. We appreciate you. And for any of you who do struggle with mental illness, or who have loved ones who do, if you want to share your story, or share, you know, how your best tips or things that you need for people to do for you when you're having your low moments, or what's the best thing someone has done to cheer you up when you're having a dark moment, anything like that, you can share that with us. Any of your thoughts?
For me, I've actually been going through depression since I was 10. I remember family members and people saying, I cried myself to sleep when I was 10, 11, 12, all the time. You're going to grow out of it. You'll grow out of it. That's what I will always hear. You'll grow out of it. Or I've had people like I've dated tell me, just shake it off. Good, ain't it? Good. You gotta hold it up, because for some reason our camera's too high. They can't see these fried tacos. I'm sorry, y'all, because I know mukbangers like to see the food.
Everything right there, yeah.
So I remember hearing, yeah, we back, so now you can kind of see us a little bit better. Yeah. Okay. So and I remember going through that, like crying myself to sleep. Sometimes I didn't even want to leave the house, but I was called lazy, or you know, you really, you know, you just don't want to do nothing. I remember it was times where it would get so bad where it would back my hemorrhoids up. Where I didn't even want to leave out the bathroom because my butt hurt. You know what I'm saying? And I know now it's issues in your tissues, things like that, and it can affect other parts of you. I remember when my mom got sick, I had lost a lot of weight, and that's when it kind of triggered again. When I was a teenager, I would go through it a lot, but I would always push through. But it happened again, and it flared my hemorrhoids up so bad I couldn't even sit on my butt. And you know, it was a stressor for me, if that makes sense. It was stress parts of my body that was weird. I I went through months of not even going out of the house, not even wanting to, you know, be around people. And, you know, and if anybody know me, I love making people laugh. And a lot of times, you know, like Robin Williams say, sometimes we know what it is to be sad or down on yourself so much that you want to see everyone else laugh. So it kind of makes you feel inadequate when you can't be there for somebody because you're so down. You know what I'm saying? And I remember going into the hospital or whatever, and the doctor's kind of like not really listening and waving it off like as if, you know, you're just trying to say something's wrong. And I remember I didn't want to go through that, so it was just like I'd rather just go through it at home or by myself, you know. But it gets so bad sometimes where it's like, if I'm up, I'm up. But if I'm down, I'm all the way down. So times like that, I don't really want to be around people. Mm-hmm. So I kind of stick to myself. But then I'm such a fighter by nature that I fight through it. It's like, no, I ain't letting this take me, oppress me, or keep me down. So I fight through it. I fight through the body aches, the headaches, the everything. I fight through it. And that's just how I always, that's my thing. In the morning, I tell myself, I fight through, I push through, I'm always looking through, see through. I mean, that's just always my thing. And it helps me, you know what I'm saying? For some people, it's worse than others. I get that, you know. But for me, it's like, I can't stop, won't stop. I can't quit. I won't give up on myself, you know.
So talk about, how is it dealing with depression and being a type A personality?
Well, people can tell instantly because I'm such a happy-go-lucky person. So I hate that when I'm having my days where I really just don't want to, you know, talk a lot. I'm to myself. I just want to do my job, or I just want to, you know, just be in my shell, you know, by myself. People always, it's like they can tell instantly. I don't like that. Because, like, for meaner people or people that really don't like people like that, they really can't tell. You know what I mean? Because I don't really like being around people. But for me, it's like, I'm like an introvert, extrovert type of personality. People don't understand that. Like, when I don't want to be bothered, I don't want to leave my house, I don't want to talk. It's like, I just want to be by myself. You know what I'm saying? And a lot of people don't understand that, you know. Or it's times where, you know, I've had nervous breakdowns where I couldn't even function. You know what I mean? Work a job. I didn't work a job, to be honest, you know.
And that's what people don't, that's what you can't see about this disease. You can't see how debilitating it can be for people. That you can't leave the house. Sometimes you can't eat, can't sleep. Sometimes you can't do nothing but sleep. You physically feel like a 50-pound baby is sitting on your chest. And you got to carry that weight around with you all the time. It can be hard. And speaking on what you said, I've had doctors also diminish what I was going through. You know what I'm saying? I was telling the doctor that I was depressed, and he said, "You're too happy to be a depressed person."
Yeah, yeah.
He said, if you were really depressed, you wouldn't even be able to hold down a job. Now, me being someone who's college educated, a person with common sense, someone who is empathetic of other people, I instantly knew that that was some bullshit and he didn't know what he was talking about. Because there are plenty of functional depressed people. You hear what I'm saying? So it's hard to go through life with a disease that, like, I feel like for people who suffer from mental illness,
Oh, hand me them hearts.
Or any disease that can be seen, it's important that you find doctors who will ride for you. Find doctors who will listen to you. You're supposed to have doctors that will listen to you, because how else are they going to make a truly informed decision on how to give you your best care? You know what I'm saying? So I had to like weave in and out of different doctors until I found the ones that would actually listen to me and take the time to understand what I was experiencing so that they could give me the best care that I needed. And sometimes a lot of people do go through just wanting to deal with it alone, because when you try to bring other people into it, it can be difficult because they're not always going to understand what you're going through. They don't have your same experience. It's like asking her to put on my glasses and ask her to see 20/20 vision.
Cause I'm like,
my vision is not for her. Her vision is not mine. We don't have the same experience. So it takes a lot to try to get someone else to see that. And going back to touching on, you know, dealing with loved ones and stuff when you're going through something like this, it's like, it can be difficult because it's draining. It's draining for both parties, you know what I'm saying?
Yeah.
Yeah.
I don't have a lot of friends, you know. My friends that I have, I hold dear. I don't have to call you 24/7. I really don't like being on the phone like that.
Some people
it really, right, it really affects me differently, you know what I mean? For me, excuse me, I choose not to give up on me or on who I want to be or who I am, you know, and that's what pushes me further. Some people can't push through it, and I'm not gonna lie, it frustrates me, because it's like, if I can lock myself in the house for 6 months, not go nowhere, not do anything, and I push through that, and in my head it's like, you can't push through this, like, and so it frustrates me a lot, you know, to see how different people deal with certain things because of everything I've been through in life. You know, I push through it, you know what I'm saying? And I know it's easier said than done sometimes for some people. But for me, it was like, I was born a warrior and I was born to fight. You know what I mean? It's been times where I literally, you know, could have drove my car in a lake, you know what I mean? And just was like, forget life. And something in me, well, I know that's the Yah factor. Something in me would not allow it, you know what I mean? Would not allow me to give up on legacy or my destiny or my purpose. I found where people, even church folks, y'all are the worst people ever sometimes when it comes to mental illness. Mm-hmm. Y'all always want to think it's a demon. And I like to cast out a devil more than anybody, okay? But everything is not a devil. You know what I'm saying? Stop telling people to come off their meds. Some people have to medicate, and that's okay. Take your meds, boo. You feel me?
You have to do what's best for you.
You gotta do what's best for you, and you know for sure you need them doggone meds. Don't be sitting up there talking about cause Sister Ricardo, whatever her name is, Brother Rico told you would got a devil and you healed and delivered. Stop taking your medicine. Listen, even the physicians, even anytime they healed anybody in the Bible, they told them to go stand them in front of the physician to make sure, to confirm that you were actually healed, delivered, set free. I don't understand, you know, for me, you know, I've told doctors that I've been depressed. Even when I was in the hospital, you know, I've told them, and they just seem like it's like, oh, okay, well, you know. So for me, I prefer to figure it out in my own ways. I found natural ways to help me. I'm sorry, I'm gonna say this. That's me being all there. You know, it's been times where, you know, I found working out, you know, helped me. Meaning loosen those natural oxytocins and, you know, things like that actually helped me. You know what I mean?
Get those endorphins going.
Yeah, you know, actually helped me. And